Why do we test for microvascular disease? One of the most important questions our patients ask is, why should I take the Pulse4Pulse test? No one ever asks why they're having an EKG or a chest x-ray, especially if it's during their annual physical exam. So why do we test? It's important to explain the risk assessment to the patient. We ask all of these questions to create a map for us to be able to take better care of them. Simply explaining to patients it is not necessarily a bad thing if they answered yes to any question, that there is a high prevalence towards microvascular disease. Our goal is to treat small blood vessels before they become diseased large blood vessels. It's the same way our skin ages as we age. Certainly, we don't look the same at 50 as we look at age 25. We may develop some wrinkles from decreased elasticity, and the same could be said for the inside of our blood vessels. We want to address this before it becomes a problem. One of our doctor's favorite sayings is, "You are healthy until you're not." Many people don't give any type of thought to this process until you're not part of that slogan. We are trying to prevent a catastrophic event or even a small event. We want to treat people before they have an event. We want to be proactive and not reactive. Here's a simple analogy. If you knew that getting into your car on any particular morning would cause you to be in an accident because your brakes were going to fail, you certainly would go and get your brakes fixed. Our bodies should be no different. We want to be safe. We want to take care of our body while it's still healthy and not be in a reactive pattern. This is called health maintenance, which is a proactive approach. It's the same as maintaining your car. The red lights on the dashboard should never come on if you take care of the car. The same could be said for our bodies. We should never have any issues that could be preventable if we knew we could prevent them in the first place. That's how important our health is. If you explain to patients using an analogy, it is very simple to forge a partnership with them, because now we know that they're in it for the long haul with us, so that we can now take care of them in a much better way. So simple things such as treating them more aggressively for their diabetes, their high blood pressure, high cholesterol, sleep apnea, for example. All of those diseases and disease processes can be treated much more aggressively if we know that it exists in the first place. So let's do this, is what I tell patients. Let's try to be proactive and preventative in terms of the way we partner together. I simply end with this. I ask the patients, "You're here because you want to stay healthy, right?" And I've never had a patient say, "No, doc, I'm here because I want to get sick." They all want to be healthy. And once you get that buy-in, once you get the patient to say they want to be healthy, well, now we can create a great partnership and move forward investing in their health together.